department alcohol and drug abuse programs. And that kind of one-by-one approach is how we really started. And then that physician connected with an obstetrician working with our high-risk patients and a neonatologist, and it made sense to figure out that by working together we could provide better services for these patients, and better coordination is going to result in better care. And it might seem really basic, but I know that for those of you who are kind of on the ground delivering services, you know that it works better if you can coordinate the services and connect with the various service providers and medical providers involved. And so that's really how our collaborative came about, by these folks coming together to try and provide better care for the small number of patients that they were serving initially. And then that grew. Our first methadone clinic opened, and fast forwarding, I think, to now, the neonatal portion of this project has delivered close to 1,200 babies. We have about 120 infants born annually to mothers on opioids. And so over the years, this approach has grown. But again, it just really started as a coming together to work collaboratively. We, in those early days, then figured out, gee, this is going to work better if we bring the other key players together. And so bringing child welfare in, bringing the community-based service providers, the State Department of Health, all of those services were key. There were clearly initial challenges, not that this collaborative idea was easy. We spent a few years trying to work out a memorandum of understanding, which we'll come to later. But those were the kinds of challenges that we faced. There were different treatment philosophies. Not everyone agreed that that women with a history of opiate dependence should ever be able to parent their children, for example. Should we share information with child welfare? What's their response going to be? How can we share this information? Isn't it all privileged information? And how are we going to overcome those barriers? So there were a lot of challenges that we faced initially. And as I go through this, I'll talk a little bit about how we overcame most of those, some of those, and how we continue to work on some of those challenges. So how it kind of works, what are we talking about? Well, our team, each of the members of the team, provide their services individually, so the prenatal care, the neonatology, and so on. But as a team, the collaboration piece of it is that